Hi friends, I am Dr. Pratap Singh Rathod. I have done the MD in Pharmacy Medicine. In today's video, we'll start with spinal poison. Mainly, one poison which is mainly important in spinal poison is Strychnous Nux Vomica. Strychnous Nux Vomica is a plant and other species of strychnous are found in jungles of India. They are spinal poisons. They usually cause poisoning of spinal cord. These are the images of the spinal tree of the Strychnous Nux Vomica. These are the leaves and the flowers. Coming to fruit, the fruit of Strychnous Nux Vomica is round, hard, slightly rough, glossy orange in color, about 4 to 5 centimeter in size, with gel-like white pulp and pale yellow pulp is seen. Each fruit may have 3 to 5 seeds. When cross section, it may have 1 or 3 to 5 seeds are seen. The seeds are flat circular disc. They have slightly convex on one side, concave on the other side. So if we take a cross section of a seed, they usually are depressed on one side and uh, convex on the other side. The cross section will be one side will be concave and one side will be convex. They are 2.5 centimeter in 2.5 centimeter in size, 6 millimeter in thickness. They are ash gray or light brown in color, have a shining surface and covered with radiating silk fibers. So they have some minor silk fibers. They are very hard, tough and difficult to pulverize. As such, if the seeds are consumed as a whole, then the poisoning will not occur since they have very tough pericarp. So only if the seeds are crushed, then only the person will have poisoning symptoms will develop, because it takes time for absorption and the tough skin, tough covering of the seeds is not digested by the stomach. The symptoms won't occur. Come to active principle. The seed consists about two principal alkaloids. One is strychnine and brucine. We both have 1.5% each are present. The seeds also contains one glucoside, which is loganin. The bark, wood and leaves contain brucine, but there is no strychnine in bark and wood. Brucine is allied to strychnine in composition and action. They both have similar action. Strychnine is only 10 to 20 times more poisonous than brucine. Strychnine occurs as colorless, odorless and rhombic principle. Just a plain active principle, if you consider it occurs as a rhombic prisms having intensely bitter taste. The fruit pulp has very low strychnine content. Mainly the strychnine is present in the seeds. All parts of plants are toxic. Come to absorption and excretion. All mucous membranes absorb strychnine. Much is taken by the liver and muscles to be either released again into the bloodstreams or to be destroyed. So usually they get absorbed and they are stored in absorbed in the liver and muscles, and they sometimes be released into the bloodstream. This leads to convulsions on second or third day of poisoning after sedation is discontinued. So once the person consumes the poison, they get accumulated in liver and muscles, and sometimes they may be stored and they again be released in the bloodstream, and the person may again develop signs and symptoms. So this is sometimes seen in after 2 to 3 days. Once the treatment is stopped, so a person may again develop signs and symptoms may develop, since they are get accumulated in the liver and muscles. About 80% is oxidized mainly in the liver. It is excreted slowly by the kidneys and traces in bile, milk and saliva. It may be found in cadavers up to 4 years. Coming to mechanism of action, it completely blocks ventral horn motor neuron postganglionic receptor sites in the spinal cord and brainstem and prevents the effects of glycine. The glycine is mainly inhibitory neurotransmitter. It usually blocks it causes the signals from the brain, and it causes mainly the relaxation of muscles. So it is inhibitory neurotransmitter, and this spinal poison blocks the action or effects of glycine on the ventral horn motor neurons. The inhibiting effect of glycine is reduced and the nerve impulses are triggered with low levels of neurotransmitters. When there is no inhibitory effect, the motor neurons do not stop their stimulus and the victims will have constant muscle contractions, leading to, which is also known as release excitation. So once the signal comes from the brain, it continuously passes on to the from spinal cord. The from the ventral horn neuron cells. They continuously stare, and the sensory neurons, the glycine which is supposed to stop, is blocked by the strychnine. So hence their muscles are continuously contracting, leading to signs or symptoms. Its action is particularly in the anterior horn cells, especially in the Rennes cells of the spinal cord. It also sometimes stimulates the cerebral cortex. GABA, which is a neurotransmitter for pre-synaptic neurotransmitter, is not affected by strychnine. It mainly affects the neurotransmitter's effect of glycine. If swallowed uncrushed, the seeds of Nux vomica have no poisonous actions and are passed entirely in the feces, since they have very tough skin, tough after covering. So they do not get, there is no symptoms, they are not digested, or it is not digested and it is easily excreted in the feces. When crushed seeds are taken, the symptoms are delayed for over 1 hour or more, and the symptoms develops after 1 or 2 hours. If the alkaloid is swallowed, means after, if strychnine as a whole is swallowed, the symptoms occurs very rapidly, which is within 5 to 15 minutes. Bitter taste is present in the mouth. Sense of uneasiness and restlessness starts developing. Later on, there is feeling of suffocation, fear, and difficulty in swallowing occurs. The convulsions, which are the main symptoms of strychnine, produced by prodromal symptoms, which increase acuity of perception, increase rigidity of muscles, and muscle twitching starts to develop. Convulsions are produced due to direct action of the reflex centers of spinal cord and affect all the muscles at a time. So all the muscles of the body are affected at a time, and all the muscles starts contracting. These are at first clonic, but eventually becomes tonic. So tonic, they are first tonic and they continues to contract. That's tonic convergence occurs. During the convergence, the face is cyanosed and has anxious eyes, looking as to staring. Eyeballs are prominent and pupils are dilated. There is typical risus sardonicus is developed, which results from contraction of the jaws and facial muscles, in which the corners of the mouths are drawn backwards. So there is a condition called as risus sardonicus, in which there is a contraction of jaw muscles and the person has a smiling face because of contraction of the corners of the mouth. The mouth is covered with froth. Frequently there is blood stain. Convulsions are most marked in the anti-gravity muscles, so that the body typically arches in hyperextension, which is known as opisthonos. So opisthonos is a condition where body is in supine position and is supported by heels and head. So in this, all the extensor muscles are contracted. So extensor muscles are affected, and the person goes in the opisthonos, where there is an arch-like a body, where the body is rested on the head and heels. The legs are adducted and extended. The arms are flexed over the chest and rigidly extended, and the hands are tightly clenched. So the legs are adducted. So legs are come together and they are extended completely. The arms are flexed. The arms get flexed and near the chest, and hands are tightly clenched. The head is bent backwards, so you can see the head is bent backwards, and the whole of the body becomes rigid, often assuming like a bow-like form. So there is typically if you see it look like a bow-like form is seen because of strychnine. So condition of opisthonos and risus sardonicus, both the conditions are seen in similarly as also seen in tetanus. So differentiating between tetanus and strychnine is essential. So coming to difference between strychnine and tetanus, usually in strychnine poison there is no history of injuries present, but there is history of injuries seen in the tetanus. So in tetanus, injuries producing injury, there is tetanus occurs. Onset is sudden, but in tetanus it gradually occurs. Converges, all muscles of the body are affected at a time. So this is one important feature where all muscles are affected, but in tetanus all muscles are not affected all the time. Some muscles are affected first, later on all the muscles some muscles are affected. Lower jaw does not start in or not especially affects the jaw. Usually starts in the lower jaw of the face, especially affects the lower jaw. Muscle contract conditions, between fits the muscles are completely relaxed. So typically between convulsions the muscles are completely relaxed, but between convulsions, between tetanus, muscles are slightly rigid. Fetal period is 1 to 2 hours, it is more than 24 hours. If chemical analysis is done, strychnine is found. Here there is no poisoning is found. Only if microscopy is done, tetanoid bacteria, Clostridium tetani bacteria will be present. Sometimes spasms the abdominal muscles may bend body forwards leading to emphysestosis or sideways to pleurostosis. So there may be forward arching may also occur where the head and leg is present, where the person may have uh, person may contract body forward contraction with the abdominal muscles contraction may occur, which is called as emphysestosis, or the person may have pleurostosis where the person contract on the sideways, that is called as pleurostosis. Consciousness is lost and mind remains clear till death. The suffering during the spasm is severe and the patient is conscious of impending danger of death. So during convergence the person's mind is clear, they doesn't affect the mind. So person's mind remains clear till death and the person has constant fear of death will be present. Duration of convergence varies from half to 2 minutes. In between convergence the muscles are completely relaxed and the patient looks well, though sometimes exhausted, and the breathing is resumed. So convergence occurs about 2.5 minutes, and it after between this the muscles are relaxed and the person will look normal. So this is present, this cycle is present, but afterwards again the person goes in contraction, the person may get exhausted. This continues till the poison is removed or the person dies because of respiratory failure. The silences lessens, cold perspiration covers the skin, dilated pupils may also contact afterwards. After 5 to 15 minutes or on slightly impulse, even the example like a sudden noise, current of air or gentle touching, the patient may again convergence may occur. So during period of relaxation, even slight impulse or slight uh, like sudden noise or sudden air can also cause contractions. In fatal cases when the person has consumed fatal dose of strychnine, then the convergence rapidly succeed one another and increase in severity and in duration, and death usually occurs within 4 to 5 conversions. So after 4 to 5 conversion cycle, the person usually dies if the person has consumed fatal dose. Patient cannot breathe because diaphragm and thoracic muscles are all fully contracted. Hypoxia causes medullary paralysis and death. So because of muscular paralysis or respiratory paralysis, the person dies because of hypoxia. In non-fatal cases, if the poisoning person has not consumed fatal dose, the interval between the convergence becomes longer and the spasms becomes less. So convergence less until this entirely stops within 12 to 24 hours and the recovery takes between 1 to 2 days. After the strychnine is oxidized and excreted in the urine, kidneys, the contraction convergence lasts for 12 to 24 hours and person may recover in 1 or 2 days. Coming to fatal dose, 50 to 100 milligram of strychnine or 1 crushed seed. If the person has 1 crushed seed, it is fatal. Fatal period is 1 to 2 hours. So if the person has consumed 1 crushed seed completely, it is 1 to 2 hours, person may die. Coming to treatment, the first step of treatment usually in every poisoning cases we go for removing of the poison, the stomach wash is done, but in this case the person's conversion has to be stopped. So here the symptom is stopped first because it is very painful for the person of conversions. The patient should be kept in dark room so that there is no stimulus is given, free from noise and disturbance. Conversion may be controlled initially with diazepam. Slowly it is given. Afterwards, phenobarbital IV is started. If it is ineffective, general anesthesia is started or muscle relaxation is given by succinylcholine, curare, galamine or pancuronium bromide is given. Between conversions, either may be administered to the point of unconsciousness. So it is started till the consciousness is recovered. Later on, short-acting barbiturates like phenobarbital sodium or sodium amytal are antidotes to strychnine and should be given in dose of 0.3 to 0.6 grams IV. So usually after controlling conversions, barbiturates, mainly short-acting barbiturates, phenobarbital are antidotes to action of strychnine and it will be helpful. Then stomach wash is done with warm water and potassium permanganate activity charcoal or tannic acid. This is helpful to remove any remaining strychnine in the stomach. So strychnine, if any remaining strychnine is present in the stomach, it can be removed from stomach wash. Acidifying the urine will also increase the excretion of strychnine. then symptomatic treatment is given. Coming to postmortem appearance, these are not characteristic. Rigor mortis usually appear early but not necessarily prolonged. This is again because the muscles are contracted stage when person dies. Because of that, rigor mortis may start early. Signs are asphyxia will be seen mainly, that is cyanosis, congestion of muscles and particular hemorrhages. These three signs will be usually present. Then extravasation of blood may be found in muscles because of conversions. There may be extravasation of hemorrhages may be present in the muscles. Hemorrhages are sometimes found under the peritoneal coat and of the stomach also. The mucosa of stomach and duodenum may show patches of ecchymosis or congestion. Lungs, liver, kidney and brain or spinal cords are congested, which is a sign of asphyxia. Because of asphyxia, they are congested. Coming to circumstance of poisoning, it is sometimes used for homicide in the form of alkaloid or as a powder nux vomica seeds. In spite of bitter taste, they are given for homicide purposes. Suicide is rare because it is very bitter and it is very painful death. Accidental deaths occurs more common due to overdosage of medicine preparations by quacks or poison be given by mistake or by children eating the seeds. Sometimes seeds are also used for killing the cattle and as arrow poison. Sometimes it is taken as an aphrodisiac also. Strychnine is also used as a respiratory stimulant, as a rodenticide, and also for killing stray dogs. Sometimes it is crushed and used to kill the rats as well as stray dogs. That completes strychnine. These are my references.